This year's event, anchored on the ambitious theme "We Can Fight TB," seeks to raise awareness about the global epidemic of tuberculosis and efforts to eradicate it. The Deputy Director, Health Services, Dr. Mamadou T. Nyasi, underscored the importance of the day, saying World TB Day is set aside to remind people about the global health threats presented by tuberculosis and to recognize the collective efforts of all stakeholders in the fight against TB.
In 2023, the Gambia registered 2,792 TB cases. This is significant improvement in TB treatment coverage from 64% in 2022 to 70% in 2023. 86% of the notified TB patients were successfully treated in 2022. In the Gambia, diagnosis and treatment of TB are provided free of charge to all irrespective of nationality, and there has never been a stock out of anti-TB drugs in the country. We thank the Global Fund for their support.
WHO Health Promotion Specialist Dr. Mamadou Kassama said TB continues to be the second leading cause of death from a single infectious agent, surpassing the toll of HIV and AIDS.
TB needs a lot of resources. What the World Health Organization recommends is that the world requires $13 billion every year to fight TB, to succeed in our global fight against TB. Where are we? And the world also needs about $2 billion for research. I'm glad our colleague from MRC has mentioned that. So we have to really think about this as a global phenomenon.
The Deputy Director of the National AIDS Secretariat, Alpha Khan, said the theme for this year's commemoration, Yes, We Can End TB, to save lives, underscored the critical importance of investing in tuberculosis prevention, diagnosis, and treatment.
Investment in research, healthcare infrastructure, and community outreach programs are essential to curb the spread of TB and save lives. We must also recognize the disproportionate impact of TB on marginalized communities, including people living with HIV, the prisoners, the migrants, and individuals living in overcrowded and unsanitary conditions. Addressing TB requires a multifaceted approach that addresses social determinants of health, promotes equity, and ensures access to quality healthcare for all.
Dr. Abdou K. Silla is the research clinician for the TB research platform at the MRC unit of the Gambia.
The aim of this celebration is to look backwards and see what have been the achievements rendered in fighting tuberculosis, and also reflects on what should we do more to fight tuberculosis disease world over. The MRC, the Gambia, through the leadership of Professor Umberto D'Alessandro, and in extension through the head of TB research, Professor James Sunderland, have put great emphasis in fighting tuberculosis in the Gambia.
Deputizing for the Regional Director of Western 2 Health Region, Brikama District Hospital Administrator Moro Yabo said tuberculosis interventions in the Gambia are implemented through the regions, and data shows that Western 2 Health bears the second highest burden of TB disease in the Gambia, with Brikama District Hospital serving as one of the busiest diagnostic and treatment centers in the country.
Our region has been working closely with the program and through our leprosy and TB inspectors together with our community health workers, intensifying case finding in the communities, diagnosing and ensuring treatment adherence to those diagnosed with TB.
TB is one of the world's deadliest diseases, and recent years have seen a worrying increase in drug-resistant tuberculosis. World TB Day is an opportunity to renew commitment, inspire effective health leadership, and take action to end the scourge of tuberculosis, which kills 1.3 million people in 2022. Yusupha Bojang, GRTS West Coast Region.